A lot of people don't realize that there are problems with breathing, with day-to-day activities, whether they feel a little bit tired at times, why they get winded, could be related to their jaw and their tongue position. And the signs can be, the bed partner may tell them that they're snoring at night, or they stop breathing for periods of time and they're gasping for air. They wake up very tired, they could have morning headaches, there could be some fogginess as far as what, memory and how they think. Traditional orthodontics has always dealt with, and traditional dentistry in general, has always dealt with what's called retractive or taking teeth out and pushing everything back. And over time, this has created a lot of problems with jaw pain, jaw popping, clicking, and it's really making the whole mouth much smaller for the tongue, for all the oral structures that now have to be jammed into a much smaller box. So the changes in our diets and what we breathe have all, coincided to create a much smaller face, a much underdeveloped face in modern humans. And as a result, this has created problems with breathing, because if the mouth is smaller, that means the nasal passages are also smaller. The jaw joints are jammed back, the tongue is hanging, half of the tongue is in our throat, which is causing restriction of the airflow. So all these things over time have created this problem, and people are not sleeping well, they're not breathing well, and just fatigued all the time. The way we deal with trying to correct these problems, obviously these are skeletal, genetic problems, as well as growth and development problems. So it requires some kind of a robust way to try to undo years of the body basically not being able to meet its genetic potential. So this appliance is called the growth guidance appliance. It's a very, very nice and effective appliance as long as it's placed in the right mouth in the right patient. And what it does is it starts to genetically remodel the bone. And this is an upper jaw appliance, because a lot of times the issue with an underdeveloped face is that the upper jaw, which is part of the skull, never fully developed. So this appliance starts to remodel the jawbone, the upper jawbone, into its genetic potential, and then we start working with the lower jaw, which is a movable jaw, into bringing that into position and finally getting the teeth to meet. So this is all part of what's called face-forward orthodontics. It is the first phase with this appliance. It's an orthopedic appliance, meaning it's a jaw-moving or bone-moving appliance. It's not doing anything to the teeth. It's developing the jawbone first, and then as a second phase, then we add the orthodontic part to it to then get the teeth to fit together to maintain this new position. So the goal is to try to reverse the corrupted development of the jaw that's taken place for many years, and we try to then undo it and try to recreate that full face that we're all capable of having. I love what I do, especially when it comes to this aspect of dentistry, because it's really such a fulfilling thing to be able to help people, especially young kids that I can tell they're not breathing well, they're not sleeping well, they're not doing well at school, and it's all because of airway problems. So if I can catch it early, and the reason I'm able to do that, and I have the privilege of being able to do that, is because of all the training I've had. Dental school and dental training is wonderful. It teaches you the basics, but over the last 20 years, I've been going to continuing education courses in the US and abroad to really learn and broaden my horizons, because there's so much more to know about the relationship of jaw function, mouth function, growth and development, overall health, that I set out on this journey. And it started out with my own problems with sleep, and one course led to another. From sleep it went to TMJ. I realized there's a connection there, and from there I met some amazing people who've been working with these different types of appliances, and I've learned so much from them. So I feel very privileged over the years to have taken over 1,000 hours of continuing education courses, and I still, as much as I can every year, try to take some form of continuing education to really learn more about not so much dentistry, but now at this point it's really the connection between dental and medical. It's really been very fulfilling to be able to offer this service to our patients. If any of you out there are watching this and this kind of resonates with you, or you have a family member or a friend's child who you think could be suffering from some of these issues, I urge you to go on our website. We have a wonderful website, columbuscosmeticdental.com. There's all kinds of information on there about airway, about growth and development, and you can Google it. There's all kinds of YouTube videos on it, or you can look up Face Forward Orthodontics. And I also recommend that if you are going to the orthodontist for a consultation, always get a second opinion, because unfortunately most conventional orthodontics are still retractive in nature, and the teeth will end up looking really pretty and beautiful, but the end result may not be healthy for your jaw joints and your airways. So again, you can go on our website. If you're ready to set up an appointment, we'd be happy to meet with you for a complimentary consultation. We'll chat as long as you need to, answer all your questions, and I hope to see you in the office soon.